Richard Hawthorne was not used to feeling helpless. The 62-year-old billionaire had built his empire from nothing, starting with a small tech company in his garage and turning it into one of the world's largest software corporations. He was known for solving problems that others deemed impossible, for finding solutions where others saw only obstacles. But now, lying in his king-sized bed in his Manhattan penthouse, he felt more vulnerable than he had ever felt in his entire life. It started 3 months ago with what seemed like a simple case of fatigue. Richard had been working 18-hour days preparing for the biggest merger in his company's history. His wife Patricia had noticed him looking pale and suggested he take a vacation. Richard laughed it off, claiming that rest was for people who hadn't achieved what he had achieved. Success required sacrifice, he told her, and he wasn't about to slow down now. But the fatigue grew worse. Soon Richard found himself struggling to concentrate during board meetings. His sharp mind, which had always been his greatest asset, felt cloudy and unfocused. Simple decisions that he would normally make in seconds now required careful consideration. His assistant, Margaret, started rescheduling meetings because Richard would sometimes forget important appointments entirely. Patricia insisted he see their family doctor, Dr. Williams, who had been treating the Hawthorne family for over 15 years. Dr. Williams was concerned by Richard's symptoms and immediately ordered a comprehensive blood panel. The results showed some irregularities, but nothing that screamed danger. Still, Dr. Williams referred Richard to a specialist, Dr. Sarah Chen, one of New York's most respected internists. Dr. Chen was thorough in her examination. She spent 2 hours with Richard, asking detailed questions about his symptoms, his family history, and his lifestyle. She ordered additional tests, including an MRI and a CT scan. When the results came back, they showed some unusual patterns, but nothing definitive. Dr. Chen prescribed medications to help with the fatigue and recommended that Richard reduce his stress levels significantly. For a few weeks, Richard felt slightly better. The medications seemed to help, and he managed to delegate more responsibilities at work. But then new symptoms began to appear. He started experiencing severe headaches that would strike without warning. These weren't ordinary headaches. They felt like someone was driving nails into his skull. The pain was so intense that it would leave him nauseated and unable to function for hours at a time. Patricia was terrified. She watched her husband, who had always been strong and invincible, become a shadow of his former self. She insisted they seek a second opinion, then a third, then a fourth. Each doctor Richard saw was more prestigious than the last. They visited Dr. Michael Torres, a neurologist at Mount Sinai who specialized in rare brain disorders. Dr. Torres conducted extensive neurological tests and found some abnormalities, but couldn't pinpoint the exact cause of Richard's declining health. Next came Dr. Jennifer Walsh, an oncologist at Memorial Sloan Kettering, because some of Richard's symptoms resembled certain types of brain tumors. Dr. Walsh ordered advanced imaging studies and even performed a biopsy, but found no evidence of cancer. She was puzzled by Richard's case and referred him to Dr. Robert Kim, an infectious disease specialist, thinking there might be a rare infection affecting Richard's brain. Dr. Kim conducted tests for every exotic infection he could think of. He tested for parasites, rare viruses, and bacterial infections that most people had never heard of. All the tests came back negative. By this time, Richard had been seeing doctors for 2 months, and his condition was steadily worsening. The headaches were becoming more frequent and more severe. He was losing weight rapidly, and his once robust appetite had completely disappeared. Patricia hired the best private medical coordinator in the city, someone who specialized in connecting wealthy clients with world-renowned specialists. Through this coordinator, Richard was seen by Dr. Lisa Rodriguez, an endocrinologist who thought his symptoms might be related to hormone imbalances. She conducted extensive hormone testing and tried various treatments, but Richard's condition continued to deteriorate. Dr. Amanda Foster, a psychiatrist and neurologist, suggested that Richard's symptoms might be psychosomatic, brought on by extreme stress from running his business empire. She prescribed antidepressants and anti-anxiety medications, but these only made Richard feel worse. He became irritable and experienced mood swings that were completely unlike his usual composed demeanor. As word spread through New York's medical community about the mysterious case of Richard Hawthorne, more specialists wanted to examine him. Dr. Thomas Lee, a gastroenterologist, thought the problem might be related to Richard's digestive system, since he was having trouble keeping food down. Dr. Patricia Novak, a rheumatologist, suspected an autoimmune disorder and put Richard through a series of painful tests. The parade of doctors continued. Dr. James Murphy, a toxicologist, tested Richard for every possible poison or environmental toxin. Dr. Sarah Peterson, a genetic specialist, conducted DNA testing to look for rare genetic disorders. Dr. Mark Johnson, an immunologist, examined Richard's immune system function. Each doctor was confident they could solve the mystery, but each left Richard's case more baffled than when they started. Meanwhile, Richard's business empire was beginning to suffer. He could no longer attend board meetings or make crucial decisions. His company's stock price started to fluctuate as rumors spread about his health. Patricia tried to keep the severity of his condition private, but it was becoming increasingly difficult as Richard's public appearances became rare and his physical deterioration became more obvious. The penthouse, once filled with the energy of Richard's business dealings and social events, had become quiet and sterile like a medical facility. Nurses came and went, administering medications and monitoring Richard's vital signs. The dining room had been converted into a medical consultation room where the endless stream of specialists could examine Richard without him having to leave the apartment. Through all of this medical chaos, one person remained a constant presence in the Hawthorne household: Grace Williams, the family's housekeeper. Grace had worked for the Hawthornes for 8 years, and she knew the family's routines better than anyone. She had watched Richard transform from a dynamic, energetic leader into a frail, confused man who barely resembled his former self. Unlike the doctors who saw Richard for an hour or two, Grace observed him every single day, noticing small changes that others missed. Grace Williams had always been observant. Growing up as the youngest of 7 children in rural Georgia, she learned early that survival often depended on noticing things that others missed. Her mother had taught her that the smallest details could tell the biggest stories, and this skill had served Grace well throughout her life. When she moved to New York 20 years ago, she brought this natural ability with her, and it had made her one of the most sought-after housekeepers among wealthy Manhattan families. At 45 years old, Grace had worked for several prominent families before joining the Hawthornes 8 years ago. She had seen wealth, illness, and family drama up close, but Richard's mysterious condition was unlike anything she had encountered before. What troubled Grace most was not just Richard's physical decline, but the way everyone seemed to be looking for complicated explanations when perhaps the answer might be simpler than anyone realized. Grace noticed things that the doctors didn't see because they weren't there every day. She noticed that Richard's symptoms seemed to follow certain patterns. The headaches were worse in the morning and seemed to improve slightly in the evening. His confusion was more pronounced after meals, and he seemed to have brief moments of clarity late at night when the penthouse was quiet and all the medical equipment was turned off. She also noticed things about the family's routine that had changed since Richard became ill. Patricia, who had always been particular about their meals, had started ordering more takeout food and relying heavily on prepackaged meals. The family's usual grocery deliveries had been replaced with medical supplies and medications. Even the cleaning supplies Grace used had been changed to hospital-grade disinfectants that Patricia insisted were necessary to keep Richard's environment sterile. But Grace's most important observation was something that none of the 15 doctors had asked about. Richard's symptoms had not started gradually. Looking back, Grace could pinpoint almost exactly when his health began to decline. It was a Tuesday morning in early February when she arrived at work to find Richard looking unusually pale and complaining of dizziness. This wasn't the slow onset of a degenerative disease. It was more sudden than that. The 9th doctor to examine Richard was Dr. Elizabeth Harper, a toxicologist from Johns Hopkins who had flown to New York specifically to consult on his case. Dr. Harper spent 3 days conducting extensive tests for heavy metals, industrial chemicals, and environmental toxins. She tested Richard's blood, urine, hair, and even samples of the air in his penthouse. All the tests came back within normal ranges, which only deepened the mystery. Dr. Harper did ask about Richard's environment, including questions about the building's ventilation system. the cleaning products used in the penthouse, and even the materials used in recent renovations. Grace was present during this questioning, and she was impressed by Dr. Harper's thoroughness. However, even Dr. Harper's comprehensive investigation yielded no answers. The 10th doctor was Dr. Kevin Chen, a specialist in rare metabolic disorders from the Mayo Clinic. Dr. Chen was convinced that Richard was suffering from a condition so rare that it might not have been properly documented in medical literature. He conducted tests that most of the previous doctors hadn't even heard of, looking for enzyme deficiencies and metabolic abnormalities that occurred in fewer than 1 in a million people. Grace watched Dr. Chen work with fascination. He was methodical and patient, explaining each test to Richard and Patricia in detail. But after 2 weeks of testing, Dr. Chen also left without answers. He promised to continue researching Richard's case and to consult with colleagues around the world. But Grace could see the frustration in his eyes. Dr. Maria Gonzalez, the 11th specialist, was a neuropsychiatrist from Stanford University who specialized in cases where psychological and physical symptoms intersected. She spent hours interviewing Richard about his childhood, his business practices, and his relationships. Dr. Gonzalez was particularly interested in the stress Richard had been under before his illness began, and she theorized that his symptoms might be a rare manifestation of extreme burnout. Grace found Dr. Gonzalez's approach interesting, but she knew Richard well enough to know that stress wasn't the answer. Richard had been under enormous pressure many times throughout his career, often much greater pressure than he was experiencing before his illness started. If stress could cause this kind of physical breakdown, it would have happened years ago during the hostile takeover attempt or during the federal investigation into his company's business practices. The 12th doctor was Dr. Paul Anderson, an expert in autoimmune diseases from the University of Chicago. Dr. Anderson was convinced that Richard's immune system was attacking his own body, causing the wide range of symptoms that had puzzled so many other specialists. He prescribed powerful immunosuppressive drugs and monitored Richard closely for any signs of improvement. For a few days, it seemed like Dr. Anderson might have found the answer. Richard's headaches became less frequent and his appetite improved slightly. But then new symptoms appeared. Richard developed a severe rash and his breathing became labored. Dr. Anderson had to stop the treatment immediately, admitting that he had been wrong about the autoimmune connection. Dr. Sandra Lee, the 13th specialist, was a forensic pathologist who had been called in because Patricia was beginning to suspect that Richard might have been deliberately poisoned. Dr. Lee had experience with cases where wealthy individuals had been slowly poisoned by enemies or even family members seeking inheritance money. She conducted tests that would detect even trace amounts of hundreds of different poisons and toxins. Grace found the poisoning theory troubling, not because she thought it was impossible, but because she realized how it would change everything about the household if it were true. Everyone who had access to Richard's food, medications, or personal items would become a suspect. Grace herself would be among the first people investigators would question, but Dr. Lee's tests also came back negative. There was no evidence that Richard had been poisoned with any known toxic substance. Dr. Lee did note that some poisons could be completely undetectable after a certain amount of time, but she couldn't find any evidence to support the deliberate poisoning theory. The 14th doctor was Dr. William Turner, a specialist in tropical diseases from the Centers for Disease Control. Dr. Turner had been called in because Richard had traveled extensively for business, including trips to remote locations where he might have been exposed to diseases that weren't common in the United States. Dr. Turner tested Richard for parasites and diseases that he might have contracted in Africa, Asia, or South America. Grace remembered Richard's business trips well because she was always responsible for packing his luggage and arranging for his clothes to be cleaned when he returned. Richard had indeed traveled to some exotic locations in the months before his illness began, including a business meeting in rural Brazil and a conference in Thailand. Dr. Turner was hopeful that this travel history might provide the key to solving Richard's medical mystery. However, after extensive testing, Dr. Turner also found nothing. Richard had not been infected with any tropical disease or parasite. His symptoms didn't match any of the conditions that Dr. Turner had seen in his decades of experience with travelers' illnesses. By the time the 15th doctor arrived, Grace could see that Patricia was losing hope. The 15th specialist was Dr. Rachel Martinez, considered one of the most brilliant diagnosticians in the world. She had solved medical mysteries that had stumped entire teams of doctors. If anyone could help Richard, it would be Dr. Martinez. Dr. Rachel Martinez arrived at the Hawthorne penthouse on a cold Thursday morning in late April. She was a small woman in her 50s with sharp, intelligent eyes and an air of quiet confidence that immediately impressed everyone she met. Grace had read about Dr. Martinez in magazines. She was famous for solving cases that other doctors had given up on, and she had written several books about diagnostic medicine that were considered essential reading in medical schools around the world. What set Dr. Martinez apart from the other 14 specialists was her approach. Instead of immediately ordering new tests or focusing on Richard's current symptoms, she spent her first day reviewing every single test result, medical report, and consultation note from the previous 4 months. She spread hundreds of documents across the dining room table and studied them with the intensity of a detective investigating a complex crime. Grace watched Dr. Martinez work throughout that first day, bringing her coffee and meals while she pored over the medical records. Unlike the other doctors, Dr. Martinez asked Grace questions about Richard's daily routine, his habits, and the changes she had observed in the household since his illness began. Grace was surprised by how seriously Dr. Martinez took her observations, treating her insights as valuable pieces of the diagnostic puzzle. "You see Mr. Hawthorne every day," Dr. Martinez said to Grace during a break in her research. "Tell me about the small things you've noticed, things that might seem unimportant but that have changed since he became ill." Grace thought carefully before responding. "Well, his sleep patterns have completely changed. He used to sleep soundly for 7 hours every night, but now he tosses and turns until about 3 in the morning, then falls into a deep sleep that lasts until noon. His appetite is strange too. He craves foods he never used to eat, like ice cream and candy, but he can't stand the smell of coffee, which he used to drink all day long." Dr. Martinez made detailed notes about everything Grace said. She asked follow-up questions that showed she was really listening and thinking about how each detail might be connected to Richard's mysterious illness. Grace found herself sharing observations she hadn't mentioned to the other doctors because they had never asked about such seemingly minor details. After studying all the medical records and interviewing Grace, Dr. Martinez spent 2 full days examining Richard herself. Her examination was different from all the others. She didn't just focus on his current symptoms. She asked detailed questions about his life before the illness, his family history going back several generations, and even his memories of childhood illnesses and injuries. Dr. Martinez also did something that none of the other doctors had done. She asked to see Richard's bedroom, bathroom, study, and all the other spaces where he spent significant amounts of time. She examined his medications, his personal care products, and even looked at the books and magazines on his nightstand. Grace accompanied her on this tour, answering questions about Richard's habits and routines in each room. In Richard's study, Dr. Martinez spent a long time looking at his desk, his computer setup, and the various gadgets and equipment he used for work. She asked Grace about the lighting in the room, the temperature, and even the types of pens and paper Richard preferred. Grace couldn't understand how these details could be related to Richard's illness, but she answered every question as completely as possible. "Mrs. Williams," Dr. Martinez said as they stood in Richard's study, "you mentioned that Mr. Hawthorne's symptoms seemed to start suddenly. Can you remember anything unusual that happened around that time? Any changes in the household routine? Any new people who came to work here? Any deliveries or purchases?" Grace thought hard about early February, trying to remember what had been different about that time period. "Well," she said slowly, "that was when we started the big renovation project in the guest wing. There were construction workers here for about 6 weeks, and we had to change a lot of our usual routines to accommodate the work." Dr. Martinez's eyes sharpened with interest. "Tell me more about this renovation. What exactly was being done?" Grace explained that Patricia had decided to modernize the guest wing of the penthouse, updating the electrical system, installing new plumbing, and completely redoing the flooring and walls. The project had been more extensive than originally planned, and it had disrupted the entire household for weeks. "The workers were here from 7 in the morning until 6 at night," Grace continued. "There was dust everywhere despite all the plastic sheeting we put up. The noise was constant, hammering, drilling, sawing. Mr. Richard had to move his office to a different room because his usual study was right next to the construction area. Dr. Martinez asked detailed questions about the renovation. What materials were used? Which contractors did the work? Were there any problems or delays? Grace answered as best she could, though she admitted that Patricia had handled most of the communication with the contractors. That evening, Dr. Martinez asked to speak with Patricia about the renovation project. Patricia seemed surprised that a medical doctor would be interested in construction details, but she provided Dr. Martinez with the names of the contractors, copies of the permits, and even some photographs of the work in progress. Dr. Martinez studied this information late into the night, and the next morning she made several phone calls to the contractors and to city officials who had inspected the renovation work. Grace overheard parts of these conversations and could tell that Dr. Martinez was asking very specific technical questions about the materials and methods that had been used. On her fourth day with the family, Dr. Martinez did something that stunned everyone. She ordered a completely different set of tests for Richard. These weren't tests for rare diseases or exotic toxins. They were tests that measured levels of common substances that should be present in everyone's body. She was looking for deficiencies rather than excesses, for things that were missing rather than things that shouldn't be there. Grace watched with interest as Dr. Martinez explained to Richard and Patricia that sometimes the most complex symptoms could be caused by the simplest problems. The human body is incredibly complex, she said, but it also depends on some very basic things being in balance. When those basic things are disrupted, the effects can be devastating and can mimic almost any disease. The tests Dr. Martinez ordered were relatively simple and could be completed in just a few hours. While they waited for the results, she asked Grace to help her create a detailed timeline of Richard's illness, noting not just when symptoms appeared but also what was happening in the household and in Richard's life at each point. As they worked on this timeline together, Grace began to see patterns that she hadn't noticed before. Richard's worst days often coincided with times when the construction work had been particularly intensive. His brief periods of improvement had occurred during a week when the contractors had been delayed and no work was done in the penthouse. Grace also realized that Richard's symptoms had evolved in a specific way. The initial fatigue and confusion had appeared first, followed by the severe headaches, then the loss of appetite and weight loss, and finally the mood changes and memory problems. This progression might be significant, Dr. Martinez explained, because different parts of the body responded to problems at different rates. When the test results came back, Dr. Martinez studied them for hours before calling Richard and Patricia into the living room for a discussion. Grace was invited to join them, which surprised Patricia but seemed natural to Dr. Martinez, who had clearly come to value Grace's observations and insights. "I believe I know what's wrong with Mr. Hawthorne," Dr. Martinez said, "but I need to do one more test to confirm my diagnosis. This final test is unusual, and it's not something that would normally be done in a medical setting. I need to test the air quality in specific areas of your home, particularly in the rooms where Mr. Hawthorne spends the most time." Dr. Martinez's request for air quality testing puzzled everyone. Patricia questioned why this hadn't been done earlier, especially since Dr. Harper, the toxicologist, had already tested the air in the penthouse and found nothing unusual. Dr. Martinez explained that she wasn't looking for toxins or poisons. She was looking for something entirely different. Sometimes, Dr. Martinez said, the most dangerous thing in a home isn't what's been added to the environment, but what's been taken away from it. Mr. Hawthorne's blood tests show deficiencies that suggest his body isn't getting something it desperately needs, and the source of that something might be environmental. Grace didn't fully understand what Dr. Martinez meant, but she was eager to help with whatever testing was needed. Dr. Martinez arranged for a team of environmental specialists to come to the penthouse the next day with sophisticated equipment that could measure dozens of different components of the air composition. The environmental team arrived early Friday morning with equipment that looked like it belonged in a science laboratory. They set up monitoring devices in every room of the penthouse and ran tests continuously for 12 hours. Grace watched them work, fascinated by their thoroughness and precision. They measured not just the obvious things like carbon monoxide and oxygen levels, but also humidity, air pressure, electromagnetic fields, and the presence of various particles and gases. While the environmental testing was taking place, Grace found herself thinking more deeply about the renovation project and its timing. She remembered details that she hadn't mentioned to Dr. Martinez, small things that had seemed unimportant at the time but might be significant. Now, the renovation hadn't just involved construction work. It had also required changes to the building's heating and ventilation systems. Grace remembered that the workers had installed new ductwork and had sealed off certain areas of the existing ventilation system. They had also updated the electrical system, which had required turning off power to various parts of the penthouse for days at a time. Grace also remembered that during the renovation, the family had temporarily moved Richard's bedroom to a different part of the penthouse because his usual bedroom was too close to the construction noise. The temporary bedroom was in a section of the building that had different ventilation and different exposure to outside air. When Grace shared these additional details with Dr. Martinez, the doctor's expression became very serious. She asked Grace to show her exactly which rooms Richard had used during the renovation and which ventilation systems served different parts of the penthouse. Together, they traced the path of air circulation throughout the entire residence. Dr. Martinez was particularly interested in Richard's study, where he had spent most of his working hours before becoming ill. The study was located in the northeast corner of the penthouse, and its ventilation was connected to a system that served several other rooms in that section of the building. During the renovation, workers had sealed off part of this ventilation system and rerouted airflow through different ducts. The environmental testing team worked late into Friday evening, and Dr. Martinez spent Saturday morning analyzing their preliminary results. Grace could see that she was excited about something, but Dr. Martinez was careful not to share her thoughts until she was absolutely certain of her conclusions. On Saturday afternoon, Dr. Martinez asked Grace to join her for what she called detective work. They went to the building's basement to examine the mechanical systems that served the penthouse. Grace had never been in this part of the building before, and she was surprised by how complex the heating, cooling, and ventilation systems were. Dr. Martinez seemed to know exactly what she was looking for. She examined specific components of the ventilation system and took measurements in various locations. She also took photographs and made detailed notes about how the systems had been modified during the renovation project. "Mrs. Williams," Dr. Martinez said as they stood in the basement mechanical room, "I want you to think carefully about this question. Did you notice any changes in the building itself during or after the renovation? Changes in temperature, in air circulation, in humidity, or in any other environmental factors?" Grace thought hard about this question. Now that Dr. Martinez mentioned it, she did remember that the penthouse had seemed stuffier after the renovation was completed. The air had felt less fresh, and she had sometimes noticed that certain rooms seemed warmer than usual. She had attributed these changes to the disruption caused by the construction work, assuming that things would return to normal after everything settled. "Actually," Grace said, "I did notice that the air seemed different. Not bad exactly, but different. And Mrs. Patricia complained several times that the temperature control wasn't working properly in some rooms. She had maintenance people come to look at it, but they said everything was functioning normally." Dr. Martinez nodded as if this confirmed something she had suspected. She took more measurements and photographs, and then asked Grace to help her trace the exact path that air took from the building's main ventilation system to Richard's study and bedroom. What they discovered was troubling. During the renovation, workers had inadvertently created a situation where air circulation to Richard's primary living spaces was significantly reduced. The rooms where Richard spent most of his time were receiving much less fresh air than they had before the renovation, and the air that was circulating was being recycled through a system that wasn't adequately filtering or refreshing it. But Dr. Martinez wasn't finished with her investigation. On Sunday, she asked the environmental testing team to return with different equipment. This time, they weren't just measuring air quality, they were measuring specific gases and compounds that most people wouldn't think to test for. The second round of testing focused specifically on Richard's study and bedroom. Dr. Martinez had the team measure oxygen levels, carbon dioxide levels, and the concentration of various gases that could accumulate in spaces with poor ventilation. She also had them test for the presence of certain building materials and construction products that might off-gas into the air over time. Grace watched this second round of testing with growing understanding of what Dr. Martinez suspected. The renovation had somehow created conditions in Richard's living spaces that were slowly poisoning him, not with a toxic substance, but with the absence of something essential or the accumulation of something harmful. When the results of the second round of testing came back, Dr. Martinez immediately called Richard and Patricia together for an urgent meeting. Grace was again invited to participate, and this time Patricia didn't question her presence. Everyone recognized that Grace's observations had been crucial to the investigation. "I now know what has been making Mr. Hawthorne ill," Dr. Martinez announced. "He has been suffering from a condition called chronic hypoxia, which means his body hasn't been getting enough oxygen. This wasn't caused by a problem with his lungs or his blood. It was caused by changes to the air in his living environment." Dr. Martinez explained that the renovation had inadvertently created a situation where oxygen levels in Richard's study and bedroom were significantly lower than normal. The modified ventilation system wasn't bringing in enough fresh air, and the sealed environment was allowing carbon dioxide levels to build up while oxygen levels dropped. "The human brain is extremely sensitive to oxygen levels," Dr. Martinez continued. "Even a small reduction in oxygen can cause fatigue, confusion, headaches, and all the other symptoms Mr. Hawthorne has been experiencing. Over time, chronic oxygen deprivation can cause serious damage to the brain and other organs." Patricia was shocked and angry. How could 15 doctors have missed something so fundamental? Dr. Martinez explained that chronic environmental hypoxia was extremely rare in modern buildings, and most doctors wouldn't think to test for it unless they had reason to suspect environmental factors. "The key to solving this case," Dr. Martinez said, looking at Grace, "was Mrs. Williams' observation that Mr. Hawthorne's symptoms started suddenly and could be tied to a specific time period. That made me think about what had changed in his environment, rather than what might be wrong with his body. The revelation that Richard's mysterious illness was caused by oxygen deprivation rather than a rare disease or poison transformed everything about his treatment and recovery." Dr. Martinez immediately moved Richard to a different part of the penthouse where the air circulation was normal while arrangements were made to fix the ventilation problems. In his usual rooms, within hours of breathing normal oxygen levels again, Richard showed the first signs of improvement he had experienced in months. The crushing headaches that had plagued him began to fade, and the mental fog that had made it difficult for him to think clearly started to lift. For the first time since February, he was able to have a coherent conversation that lasted more than a few minutes. Grace watched Richard's transformation with amazement and relief. She had grown genuinely fond of the Hawthorne family during her 8 years of employment, and seeing Richard suffer while no one could help him had been heartbreaking. Now, as his natural color returned to his face and his eyes became alert and focused again, Grace felt a deep satisfaction that her observations had played a crucial role in solving the mystery. Patricia was overwhelmed with gratitude toward Dr. Martinez, but she was also angry about the months of suffering that could have been prevented if someone had thought to investigate environmental factors earlier. She was particularly frustrated with the building's management company and the renovation contractors, whose modifications to the ventilation system had created the dangerous conditions. Dr. Martinez arranged for immediate repairs to the ventilation system, bringing in specialists who could restore proper air circulation to all areas of the penthouse. She also consulted with Richard's other doctors to coordinate his recovery plan. Many of the medications he had been taking were no longer necessary, and some were actually hindering his recovery now that the underlying cause of his illness had been identified. The process of fixing the ventilation problems was complex and expensive, but Patricia spared no expense to ensure that it was done correctly. Environmental engineers thoroughly analyzed the entire system and designed improvements that would prevent any similar problems in the future. They installed monitors that would continuously measure air quality and alert the family if oxygen levels ever dropped below safe ranges. As Richard's physical health improved, Grace noticed that his personality was returning to normal as well. The mood swings and irritability that had characterized his behavior during the illness disappeared, replaced by his usual calm and focused demeanor. He began taking an interest in his business again, though Dr. Martinez cautioned him to return to work gradually to avoid overwhelming his recovering brain. Within 2 weeks of the ventilation system being repaired, Richard was able to move back to his original bedroom and study. The difference in how he felt in these spaces was dramatic. He could immediately sense that the air was fresher and more comfortable than it had been for months. He hadn't realized how stuffy and oppressive the environment had become until he experienced the contrast with properly circulated air. Grace played a crucial role in Richard's recovery by monitoring his daily condition and reporting any changes to Dr. Martinez. Her detailed observations continued to be valuable as Richard's medical team tracked his progress and adjusted his treatment plan. Grace noticed that Richard's appetite returned to normal within days. His sleep patterns improved significantly, and his energy levels began to stabilize. Dr. Martinez stayed in touch with the family throughout Richard's recovery, fascinated by the case and eager to document it for medical literature. She explained that environmental hypoxia in residential settings was so rare that Richard's case would likely be studied by other doctors for years to come. She credited Grace's observational skills as being essential to solving the mystery. Richard himself was deeply grateful to Grace for her role in his recovery. He had always respected her work and appreciated her dedication to the family, but now he understood that her attention to detail and willingness to share her observations had literally saved his life. He increased her salary substantially and gave her a significant bonus, but more importantly, he made sure she knew how much her contribution had meant to him. The story of Richard's mysterious illness and recovery became something of a legend in New York's medical community. Dr. Martinez wrote a detailed case study that was published in several prestigious medical journals, helping to educate other doctors about the importance of considering environmental factors in difficult diagnostic cases. The case also led to changes in building codes and ventilation standards to prevent similar incidents. Grace found herself somewhat famous within the household staff community of Manhattan's wealthy families. Word spread about how her observations had solved a medical mystery that had stumped 15 specialists, and other wealthy families began requesting her services. However, Grace was loyal to the Hawthorns and had no interest in leaving her position, especially after the experience had brought her closer to the family. Patricia, who had always appreciated Grace's work but had maintained a formal relationship with her, began treating Grace more like a trusted advisor and friend. She consulted Grace about household decisions and included her in family discussions in ways she never had before. The crisis had shown Patricia that Grace's insights and observations were genuinely valuable, not just for housekeeping but for understanding the family's well-being. The renovation contractors and building management company faced significant legal consequences for their role in creating the dangerous conditions. Richard's lawyers pursued both civil and criminal charges, arguing that the improper modification of the ventilation system constituted negligence that could have resulted in permanent brain damage or death. The case was settled out of court for a substantial sum, which Richard donated to medical research. Dr. Martinez remained involved with the family as Richard's primary care physician, replacing their previous family doctor, who had failed to consider environmental factors. She established protocols for regular air quality monitoring and created a comprehensive health maintenance plan that took into account Richard's unique living environment and lifestyle. The experience had also changed Richard's perspective on health and medicine. He had always believed that money could solve any problem, but his illness had shown him that even the most expensive specialists could miss fundamental issues if they didn't approach problems with the right mindset. He became an advocate for more holistic approaches to medicine and funded research into environmental causes of illness. Richard's business empire had suffered during his months of illness, but his recovery allowed him to regain control and restore investor confidence. However, the experience had changed his priorities significantly. He began delegating more responsibilities to trusted executives and spending more time with Patricia, recognizing how close he had come to losing everything that truly mattered to him. The relationship between Richard and Grace evolved dramatically after his recovery. She was no longer just a housekeeper in his eyes. She was someone whose careful attention and willingness to speak up had saved his life. He consulted her about business decisions that involved employee welfare and workplace safety, valuing her practical wisdom and attention to detail. Grace's role in solving the mystery had given her newfound confidence in her own abilities and judgment. She began to see herself not just as someone who cleaned and organized, but as someone whose observations and insights could make a real difference in people's lives. This confidence served her well as she continued working for the Hawthorns and took on additional responsibilities in managing the household. The case also had broader implications for the medical community in New York and beyond. Several hospitals began incorporating environmental assessments into their diagnostic protocols for mysterious illnesses. Medical schools started teaching courses about the importance of considering a patient's living and working environment as potential factors in difficult cases. 6 months after his recovery, Richard established a foundation dedicated to supporting research into environmental causes of illness and improving diagnostic training for doctors. The foundation's first major project was developing guidelines for healthcare providers to follow when investigating environmental factors in mysterious medical cases. Grace was honored at the foundation's inaugural dinner, where Richard publicly credited her with saving his life. Standing before an audience of New York's medical and business elite, Grace spoke about the importance of paying attention to details and trusting your instincts. Even when experts seem confident in their conclusions, the experience had taught everyone involved valuable lessons about the limitations of specialized knowledge and the importance of looking at problems from multiple perspectives. Richard's case demonstrated that sometimes the most complex medical mysteries have surprisingly simple explanations, and that the key to finding those explanations might come from the most unexpected sources. 2 years after Richard's remarkable recovery, the Hawthorne penthouse had become a showcase for healthy living environments. The ventilation system had been completely redesigned with state-of-the-art technology that monitored air quality continuously and automatically adjusted circulation to maintain optimal oxygen and humidity levels. The penthouse now served as a model for other luxury residences, and environmental engineers from around the world came to study its innovative features. Grace had become something of a celebrity in her own right within New York's domestic worker community. She was frequently invited to speak at training sessions for housekeepers and personal assistants, where she shared her experience and taught others about the importance of observing and documenting changes in their employers' health and behavior. Many wealthy families specifically requested housekeepers who had been trained in Grace's observation methods. The medical case study written by Dr. Martinez about Richard's illness had become one of the most cited papers in environmental medicine. Medical schools around the world used it as a teaching example of how critical it was to consider all possible factors when diagnosing mysterious illnesses. The case had also led to new protocols at major hospitals requiring environmental assessments for patients with unexplained symptoms that had persisted for more than a month. Richard's foundation had grown into one of the most respected organizations funding research into environmental health issues. The foundation had sponsored studies that identified dozens of cases similar to Richard's, where building problems had caused serious health issues that were initially misdiagnosed as rare diseases. These discoveries had led to new building codes and safety regulations in major cities across the United States. Grace continued working for the Hawthorne family, but her role had expanded far beyond traditional housekeeping duties. Richard consulted her regularly about business decisions, particularly those involving employee health and workplace safety. Her practical wisdom and attention to detail had proven valuable in identifying potential problems before they became serious issues. Patricia had also come to rely on Grace's judgment about family matters and household decisions. The relationship between Grace and the Hawthorne family had evolved into something closer to friendship than employment. While Grace maintained her professionalism and continued to perform her housekeeping duties excellently, she was now also a trusted advisor and confidant. The family included her in holiday celebrations and important events, recognizing that she had become an integral part of their lives. Dr. Martinez had become the Hawthorne family's permanent physician and had also developed a thriving practice specializing in environmental medicine. She credited her experience with Richard's case as transformative in her approach to patient care, and she now routinely investigated environmental factors in all of her difficult cases. Her success rate in solving mysterious medical problems had increased dramatically since adopting this more comprehensive approach. The story of Richard's illness and recovery had been featured in medical journals, business magazines, and even a documentary film about the importance of environmental factors in health. The case had sparked widespread interest in indoor air quality and had led to the development of new technologies for monitoring and improving residential air systems. Richard himself had become an advocate for what he called environmental health awareness. He spoke at conferences about the importance of considering environmental factors in both personal health and employee wellness programs. His company had become a leader in providing healthy work environments for its employees, installing advanced air quality systems in all of its offices and requiring regular environmental assessments of all workspaces. The experience had also strengthened Richard and Patricia's marriage in unexpected ways. The months of uncertainty and fear had made them both realize how precious their time together was, and they had recommitted to prioritizing their relationship above business concerns. They traveled more frequently, spent more time with friends and family, and made sure to maintain the healthy lifestyle that had become so important to them. Grace had used her increased salary and bonus from the Hawthorns to purchase a small apartment in Brooklyn, fulfilling a lifelong dream of home ownership. She had also been able to help her siblings in Georgia with various financial needs and had established a small scholarship fund at her old high school for students interested in careers in healthcare support services. The renovation contractors who had created the dangerous ventilation conditions faced ongoing legal and professional consequences. Several were forced to pay substantial settlements and lost their licenses to work on residential projects. The case had become a cautionary tale in the construction industry about the importance of properly understanding and maintaining building systems, particularly those affecting air quality. The building management company that oversaw the Hawthorne penthouse had implemented comprehensive new protocols for monitoring and maintaining air quality in all of their properties. They had also hired Grace as a consultant to help train their maintenance staff in recognizing signs of environmental problems that might affect residents' health. Looking back on the entire experience, Grace often reflected on how her simple attention to detail and willingness to trust her observations had led to such dramatic consequences. She had learned that everyone's perspective was valuable and that sometimes the most important insights came from people who weren't considered experts but who saw things that experts missed. Richard frequently told people that Grace had taught him one of the most important lessons of his life, that wisdom and valuable insights could come from anywhere, and that listening to all voices was essential for solving complex problems. This lesson had influenced how he ran his business, managed his foundation, and approached relationships with everyone in his life. The case had demonstrated that medical mysteries often required interdisciplinary thinking, and that the most effective diagnostic approaches involved collaboration between medical professionals and people who observed patients in their daily environments. This understanding had led to new training programs for healthcare workers that emphasized the importance of gathering information from all available sources. As Grace continued her work with the Hawthorne family, she carried with her the knowledge that her careful observations and willingness to speak up had literally saved a life. This experience had given her confidence that would serve her well in all aspects of her life, and had shown her that every person's perspective and insights were potentially valuable in ways they might never expect. The story of how 15 doctors failed to save the billionaire until the black housekeeper discovered the overlooked clue had become more than just a medical case study. It had become a powerful reminder that solutions to complex problems often require listening to voices that might otherwise be overlooked, and that the most important insights sometimes come from the people who see things most clearly because they see them every day.